Hi, everybody. Valerie McSorley here to welcome you to another episode of CX Tech Talks, where we bridge AI with CX. The series is sponsored by Zappix. And today, I'm really excited to sit down with Deepan Vashi. He's the EVP of Healthcare Solutions with Firstsource. And Deepan, it's a pleasure to welcome you to the show today.
Absolutely. Pleasure is mine, Valerie.
Thank you so much for being here. I have to say, you're a beloved resource for Yossi and Bob. They speak really, really highly of you and the relationship they have, not only with Firstsource, but of you as well.
Yep. I've also been working with Yossi, Bob, and Zappix team for almost 4.5 years. So we have a great partnership.
That's great. That's great to hear. So on this series, we try and talk a little bit about sort of the latest AI insights and trends and how we're really bridging the gap between CX and AI with a variety of different solutions in the marketplace. Can you tell me a little bit about your experience?
So AI has been permeating in all areas of healthcare. I come more from a healthcare area, so that's what I'll speak about. While Zappix works in a number of different industries, and we also work in a number of industries, but my area of specialization is mostly healthcare. So I'll speak morely from that context, both from health insurance as well as healthcare delivery, which is our providers, hospitals. So from that standpoint, I'll convey my thoughts. Now, when we look at AI for healthcare and more so from a CX, this is one industry which is probably least mature when it comes to AI experience. And all of us as healthcare consumers, we look forward to that. Hey, could we get experiences similar to retail, similar to telco, similar to education and other industries, and how AI or CX has moved in those industries, or airline, for example? That's something which is yet to be done in healthcare. So that's number one. And number two, AI definitely gives a level playing field now with a lot more technologies that you can jumpstart and get and come closer to these industries in terms of experiences. So what do we mean by those experiences? Well, so if you look at, hey, can I get, when the need arises for a healthcare, can I get the right provider, right doctor, right specialty? And can I navigate that quickly enough? And if I were to call a health insurance company, do I have to wait for a long time on a phone versus do I get multiple channels that I'm comfortable with? I'm probably doing my laundry on a Friday evening. And at that time, I want to search as to, hey, what is the best provider I should be catching up with next week? Because now I'm 50 plus. And I need to see a doctor to make sure that I go through my cancer screening, colorectal cancer screening, some other screening. If there were to be a lady that wants to, respectively, they want to do other screenings, who's the best available? And if you were to navigate, it's very complex. I have to go and figure out with my provider, who might be PCP or my family doctor, and then move on from there. And that's how I navigate today. But there are a lot of tools available now using AI. Hey,
Yes.
Within 10 miles distance, who's the best provider based on my preferences? Not necessarily what health plan tells me, but something based on my clinical profile, my psychographics, my demographics. Based on that, then you recommend that, hey, here is a provider that you should visit. And these are the things that you could do. Instead of me searching, the health plan or the hospital sends me the alerts that, hey, Deepan, you're 50 plus now. You got to do 1, 2, and 3 checks. Right? So that's where the AI will make a difference.
That's interesting. And something that you touched upon is how the patient experience is pushing for more similar experience as they have in retail. So I think it's interesting to see amongst different industries where the consumer or patient experience is really demanding and where they're more forgiving, because not having those tools at their fingertips in a retail experience versus a healthcare experience is very different. It's a very different experience from the consumer standpoint.
Exactly. So now think of it that someone who's age 65 plus and wants to enroll into Medicare. Even more challenging for someone who's a senior citizen and then navigate this journey, right? As to how do how much do I need to pay for this insurance? What comes through Medicare? What do I need to buy additional so that I'm covered based on my needs, right? So that's where AI is bringing a lot of changes. Now, the project that we worked with Zappix in a similar area was on the health risk assessment, wherein we use Zappix capabilities along with the Firstsource capabilities together and put digital health risk assessment, which used to be completely manual. So identifying members that, hey, who are the ones who needs to go through this risk assessment, sending them digital surveys first. And if you don't get a digital survey, then you do outbound calling. So that's how we put the entire structure together. And then this is a project that's successfully running, giving great business outcomes for more than a year now.
That's great. Can you share what some of those outcomes have looked like for you?
Member engagement has been better, has improved considerably, and we've saved a ton of money for our client, almost 20% plus.
Oh, that's awesome. That's great. Yeah, I think there is such an incredible ROI that goes around these modernizing these solutions, and particularly when you can automate in a way that is useful for both sides of the equation here, and the patient experience there, and for the payer side as well. So you can usually put that ROI piece, I think, is really important as people are looking at new AI solutions and understanding the investment and the ROI that you will reap from it. Because I think we, as leaders, get very caught up in our budgets, but it's important to understand and put these tools to the test to see how they can impact your bottom line.
Yep. Other areas that we work with Zappix team also is on the health insurance side, wherein have used visual IVR and put in front of our providers to utilize that so that they can identify, hey, whether the member is eligible or not, or what's the claim status, and number of other use cases using this technology.
That's great. That's great. And from the perspective of bringing these increased solutions to your clients, how are those received? The results really speak for themselves, right? That makes
results speak for themselves, and the adoption is great. So these tools, members, providers, and even health insurance clients, hospitals, they are looking forward to these solutions. Another one is visit adherence and doing the visits wherein you could do appointment scheduling and those capabilities. Again, identifying using AI that, hey, who needs the appointment, and then giving flexibility across multiple channels to patients that they can schedule appointments and educating them throughout the process that, hey, what needs to be done as you come for those appointments, how do you need to prepare for it, as well as some videos that you present back to them as to, hey, before your appointment, this is what needs to be done. This is what you can expect during the appointment. After you finish the appointment, you're rescheduled, or the next one will come after a month. Usually there are cases, those episodes that, hey, you need to go for a follow-up. And then that would happen, say, after a month or 2 months. Here is how reminders would come in. So creating that entire episode, creating that entire support system for the patient so that they can navigate very easily. So those are the capabilities that we've built jointly, and we're taking it to the hospitals and health insurance clients.
So that whole patient journey is really captured in a very easy to use format for both sides. Are you seeing measurable results around no-shows?
Absolutely, we have seen measurable results around no-shows, but very interestingly, it's the clinical hours which are saved. Right? Because a no-show, actually what happens is it's more than the revenue. It's the clinical resources are idle, and no hospital would like to do something like that, right? So as you make sure that no-shows are avoided and late cancellations are avoided, or late reschedules are avoided, you save on clinical hours because your utilization of clinical resources is far better.
That's excellent. So where are some of the ways that you see AI shifting the patient experience in the future?
I think the consumer experience is going to change with AI, with more and more Gen AI coming in. So education of patients as well as the content that needs to be created, which today takes probably a month to produce, will be produced now in a day or two. Right, so that's the power of Gen AI, and making sure that you are producing right content, right channel, and at the right time of the week, right day of the week, right time of within a day, so that you are personalizing the entire messaging for a particular member or a particular patient.
Absolutely critical. Absolutely critical that messaging matches the channel and meets the consumer or the patient where they're at all times. And the speed to implementing these things, just as you said, I mean, we were in discussions all week where we're taking what used to be 6 or 8 month projects down to a number of weeks, because it's just the speed to providing accuracy, and all of the tools are there. So the technology is there. I think it's great that to see all these pieces adapting.
What I also see very interesting is that today, when you acquire a new member or a new patient, it's very limited. The technology used is very limited. That's where I see more and more AI being used, so that you can identify the right patients, bring them in, continue to serve them more and more. That's another big area of focus.
Well, that's a great use case.
One is servicing, which is after you acquire a member or a patient. But before that, there are other use cases which are extremely important, because that's what will drive revenue for our clients.
Well, even just the smart forms, it takes a lot of the administrative burden off, right? It's very easy to accomplish. But there's just so many, it just makes for a smoother experience. No one wants to go to the doctor's office 15 minutes early and fill out the same forms in triplicate, and that are just going to sit in the file. This way, it's so much better, so much easier. And it's just a great way to.
That's a lot of data-driven insights and predictive analytics that is being used. So it's a combination of technology, not just Gen AI because it's the new buzzword, but a combination of technologies in terms of multiple channels, AI, availability of data, structured and unstructured, and then Gen AI adds a little more spice to it.
Well, I think what you're raising is an interesting point, and it's about the automation piece, because AI is thrown around as such a big concept, and there's so many different uses, so many different use cases, so many different providers. Everyone wants just AI. It's just being thrown at you so fast. People, I think, need to understand on the roadmap and the journey where you need to start. And automation is the best, easiest way to start. You've got to build on a solid, strong, and secure foundation.
Yeah, that's where we build proactive interventions and preventive care programs, because when you build those proactive engagements is where your preventive care will work really well.
Absolutely. And the follow-up and all of the patient education pieces that you can easily send to them. And then from the engagement standpoint too, you can see who's not engaging with the tools, and then start to identify where there's potential risks around, the no-show piece, the late piece. You can identify the culprits. You can have a much better pulse on what's going on within the organization. So
exactly. There are also considerations and challenges when you deal with AI. So, for example, there are data privacy and security challenges. So we got to work with our clients, assuring them that, hey, here is how data would be used. We do not use your data to train the models. We do not use your data to train and use it out elsewhere. This remains within your 4 walls only, and addressing potential algorithmic biases. So you now got to do a lot more testing. Make sure that the data that we are using is representative enough, and therefore it does not introduce bias. So those are very important perspectives that we must discuss with our clients upfront, making sure that maintaining a human touch in the interaction is equally important, right? So when do you use technology, which is high tech? When do you use high touch? So bringing both together, high tech and high touch. And that's how we navigate the regulatory and ethical considerations, making sure that we are serving right, using the technology optimally. Not necessarily that, hey, someone who's 80, do not use technology. They want to talk. Seniors want to talk, right? So use appropriate human touch where it is necessary. We don't have to everything doesn't get automated, and we live in human world.
Yes, and this is what we talk about at Zappix all the time. We talk about humology and blending humans with the technology piece and bringing in AI and understanding from our client and patient perspective what channels they want to be contacted on. So who prefers phone, who prefers a text? I mean, some folks want to do everything with these phones except talk on them. So I think that's the right approach. And I love that the way that you continue to meet people where they're at and use the technology to help the agents and help the patients and just bridge the gap in the experience. And I'm sure you're seeing the reviews from your clients in terms of their enhanced experience overall.
Absolutely.
So I'll ask you one final question. What's keeping you up at night around AI in the future?
I think the pace of change, the
Yes.
way technology is changing so rapidly, that is one. So that we want to make sure that you're using the right technology and not and the right use cases. Don't What keeps me awake is really when we use the same new GenAI hammer and keep looking for nails. That hey, can I solve this? That's where we need to use design thinking and make sure that you design it right.
Yes.
Design it with patient and the persona of the patient or a member at the core, at the center, and then design it based to, hey, where does high touch come in? Where does high tech come in?
Perfect. Perfect. Well, I hope you get some
To be
sleep
more,
because those are
it
big
is
things to tackle.
it is said that in order to be more digital, we have to be more human first.
I
It's
love that.
counterintuitive, it's counterintuitive, but it's very important to see that, hey, the human emotions are considered, and at every touch point, we reduce the level of effort that the member or a patient needs to put in, and we provide the right level of support. Now, it could be human support in right personas, or it could be tech support. Someone who's 20 years old, 25 years old, wants to use everything on their smartphone, versus someone who is 65 or 70 or 80 needs a human support, and make sure that both are supported in appropriate way.
Well, that's really touching on the digital orchestration piece too, that Zappix provides with identifying that by cohort and communicating to those cohorts appropriately. So this
Absolutely.
is
That's
this is
where
excellent.
both the demographics as well as the entire profile of the member or a patient is very important. Look at the profile
Yes.
and then introduce the interventions that, hey, here is the channel through which you want to reach. Here is the type of content you want to serve.
And really building around those preferences to provide, and again, it just always comes back to meeting people where they're at.
Exactly.
Well, Deepan, I want to thank you so much. This has been great. It was a pleasure to speak with you today, and I look forward to hearing more about the great success that you continue to have with Firstsource.
Thank you, Valerie.
Thank you.
Appreciate your time. Thanks. Bye.
Thank you. Bye-bye.